Alright, I'm gonna go on faith that we're actually broadcasting. Hello, all you cats out there, all you fleshlights, and various other things. We're gonna do a little bit of a article analysis today. Hope everyone's doing well. I hope there's no background noise. According to what I /see/hear, there shouldn't be any background, like, blaring air conditioner. I turned it on low, but I need it to be on because it sucks today. Yeah, hope everyone had a good weekend, and man, I just hope it's been better than mine, because I have been trapped inside with all this freaking heat wave and 35, 36 weather outside. That's terrible. Heat stroke is not fun. I can tell you that now as a pale person. Hey, that's Terrace, bro. I see you. Alright. So, today, I finally realized I can live stream again, or for the first time in a few years. And I never did this video that I kind of wanted to do back when I couldn't live stream. Which is, it's really easy to do a debunking video on a bunch of reactionary, postmodern conservative chuds like Sargon, like Out-Skeptic, who try to find excuses for all the data they read. Because, I understand the thought process that they go through, but I think that saying that people like that are wrong is kind of half missing it. So I'm going to do a thing here with you. So this is an article from today's, actually, let's just maximize that for everybody. This is an article from today's Portland Press Herald from the state of Maine, just for credit where credit's due. This is talking about the racial disparity in COVID-19 cases, which you may or may not be aware of, which the article will go into, so that's fine. So I am going to teach you how to evolve thought process behind a skeptic and try to carry them to the next logical step that makes sense, because most of these people who take the easy way out and try to look for excuses are just stopping their logic process. They aren't necessarily abandoning a logical process, because I'll share what happens in my head. Now, at first, I think I found this on Twitter, because I don't think it was on Fark today. But I found this on Twitter, and someone had just basically summarized this headline and tag here. Maine has the nation's worst COVID-19 racial disparity. No other state has such a wide gap, more than 25 percentage points, between the size of the Black population and that community's share of infections. Now, you know how Sargon or Greg or Shu or anyone else would defend this kind of article, right? Maine has one of the smallest COVID infection rates in the country because they've managed to instigate a lot of early and extensive lockdown procedures. They've taken a lot of very cautious quarantine procedures for out-of-state visitors. I believe they're slowly lifting restrictions now for the tourist season, obviously. They can't go the whole summer without a single tourist. That would kind of destroy their economy. Like, worse than like just a stock market. But Maine's COVID rate is presently, I believe, something like 1/3 of the national average, which, again, because of hotspots, it's hard to necessarily imply anything from that, but they've been doing pretty good. They look like a European country that has its act together. So the first thought when you see racial disparity like this is, well, there might not be a lot of cases because, COVID is communally transmitted, right? Your first thought process is that you can't necessarily infer anything from the data because the sample size might be too small, right? For example, if this is spreading through contact, it makes sense that contact between people in the same family might share skin color, right? That makes a certain kind of logic. So spreading through small communities and grabbing everyone in those smaller communities before they're insulated from the outside might skew the numbers somewhat, which we've seen happen in other areas as well. This is also, strangely enough, the same reason why reactionaries tend to be wrong about caring about black on black violence and white on white violence, because you tend to commit crimes against people you know, and you tend to know people in your racial group because, again, your family tends to share your racial group, that kind of thing. Here's the problem, of course, is that someone like Sargon would stop there. That would be the end of his critical thinking. But you can keep thinking. You can evolve beyond when you were 16 years old. So let's read the article for the rest of this data. Maine now has the nation's largest racial disparity, with statistics showing that members of the state's small but growing Black communities are contracting COVID-19 at a rate more than 20 times that of the white residents. Maine is one of the lowest infection rates in the country on a per capita basis, but for Black residents, the picture is dramatically different. Recent immigrants with lower incomes, more limited access to healthcare, and less job security even before the pandemic. And this is no statistical anomaly caused by Maine's small minority population. Again, this is trying to dissuade that very apologist skeptic thought process, right? That if pretty much, as is the case in Maine, most of your colored community, that is all minorities, live in one or two cities, which is the case in Maine, that might skew the numbers. So they're trying to disprove that with this data. So here is the percentage of the Black population among the infected, the percentage who are Black, and the proportional rate of Black infections to the population. So here is in Maine. Maine has one of the smallest Black populations in the country. I think they tend to be neck and neck with Vermont. They jockey for position in that title. Among the infected who are Black, it's 23%. So that means of all COVID cases, 23% are coming from the 1.4, and the proportional rate of Black infections to population, which of course is much higher than it should be. For comparisons, here are some other states: Missouri, Michigan, Minnesota, Alabama, Mississippi. So there's a wide variety of states here. So states with an overrepresentation of Black people, Mississippi, are still overrepresented in the infected. They're still overrepresented in Alabama, and in a similar state like South Dakota, which also has its communities of color clustered into a single city or two, they still have a disproportionate rate, but it is much lower than the rate in Maine. So let's keep reading. As of Saturday, Black residents accounted for at least 713 of the 2,500, or closer to 2,600, COVID cases in Maine where the race of the individual is known, which is a staggering 27.7% of cases, despite the fact that Black residents represent just 1.4% of the state's population. Even including the 360 individuals of unknown race or ethnicity, Black residents still account for 24.3% of all cases. And those 360, there might be some Black people in there too. No other state has such a large disparity a gap of more than 25 percentage points among cases where they are known, between the size of the Black population and the community share of cases based on analysis of racial data compiled by the COVID Tracking Project. Now, these numbers are kind of important because this is kind of outside the realm of statistical insignificance, right? For example, we might be able to excuse it away as data anomalies if it was like, as was said earlier, if it was just, someone in a small isolated community spreading it to their family, who spread it to their friends and family, that might explain it, right? A localized cluster in a single spot. But unfortunately, 713 is a lot more than you would expect from that kind of situation. 713, that's more than, a couple of gated communities, right? That takes a lot of inter-community transmission and transmission across populations. So there's something at play here. And 2,500 is plenty of a sample size. We do national polling with less, so the sample size is fine. So it's definitely not skewed because of that. So that checks off one thing. Because remember, we're trying to be a skeptic here. We're trying to prove it wrong through our arguments. So we're going through and trying to figure out if there isn't a problem. Now, this article, I'm going to spoil it for you, doesn't go into why necessarily there's no conclusive answer, only a bunch of suggestions as to why. But because there is no conclusive answer as to why this disparity exists, that therefore does not mean that the disparity does not exist, as someone like Armored Skeptic would probably try and tell you. COVID's disproportionate impact on Black communities in Maine comes at a time when large-scale protests and rallies have thrust the issues of racial justice and systemic racism into the national conversation. The Maine Immigrants' Rights Coalition, which includes 69 grassroots groups and agencies, call the disparity enormous and growing. The Black and people of color communities are in unfathomable pain, distress, and devastation due to disproportionate impact on their overall well-being, as well as limited access to services in the midst of the pandemic, said the Maine Immigrants' Rights Coalition Board of Directors. This is important because the article won't tell you, because this is a local paper, but most of Maine's minority population are immigrants. There are very few African American people in the Black community in Maine. Maine's COVID-19 disparity comes even starker when examining the numbers on a per capita basis. 1 out of every 27 Black residents has tested positive for COVID-19, based on the case numbers from the Maine Center for Disease Control and Prevention and the 2018 estimates of the U.S. Census Bureau. For white residents, the figure is 1 out of every 725 people. So the chance of getting COVID if you are a Black person living in the state of Maine that's more than 3 times. I don't have a calculator right in front of me. I mean, I do, but I don't have it open. We could find out. We could find that out, because I'm not so great at math, because it's been 20 years since I was in high school. Okay, 26 times more likely. That's a lot. That's a lot. 26 times more likely is definitely statistically significant. So something is definitely going on. Can we dismiss it with something else that's regional? Well, maybe. But generally, we're already out of the realm of as far as most people like Sargon go. But we'll keep going. Why did I do that? It's right here. An analysis of Maine Center economic policy yielded similar results, albeit using a different analysis of the numbers. Infection rate of 1.4 for every 1,000 residents of Maine as of June 20th. The rate for Black Mainers, by comparison, was 37.6 per 1,000, so 27 times more likely. So two different groups came up with the same number, or roughly the same number. So if it's been independently verified, we can assume that the numbers are probably reliable. Obviously, everything is always evolving in COVID, so we don't want to necessarily take everything as gospel, but for the data that we have now, the data we should move forward and assume is correct, this appears to be fine. Here's the good news. Data from the Maine CDC suggests that, unlike in other states, Black residents of Maine are not dying of COVID-19 at disproportionately high rates, and the total number of COVID-19 cases in Maine remains low compared to other states. But state officials are well aware of the growing disparity and are working with community organizations in cities with larger immigrant populations to increase access to testing and safe isolation spaces while stepping up educational programs. Now, this is important because this rules out another thing. Maybe one might say, if you were gargle septic, that perhaps Black people are just more vulnerable to the disease. That can happen, right? This is basically an extension of the sickle cell anemia phenomena, which is sickle cells are developed in African genealogies because of malaria and other diseases that spread through the tropical regions of Africa, and therefore they develop genetic defenses against them. So in the same token, maybe there's something like that going on where there is this component that is somehow genetic, that maybe they are more susceptible to disease. But as we see here from this paragraph, the Black people who catch it in Maine are not dying at the rate that they are in other places in the United States, which is presumably because Maine is controlling its COVID infection so well that their hospitals aren't anywhere near to the point of being over encumbered by anything. Oh, hello, dear Alt Chucky. Who is Sargon? I only know Sargon as the one entity that took possession of Captain Kirk. I'm making fun of Sargon of Akkad, who is a YouTuber who keeps getting defunded. Carl Benjamin, maybe you heard of him. He ran for office in the UK like a year ago. Oh God, it's been a year already since Carl ran and destroyed the UKIP party in the process. That's the Sargon I'm referring to. Not the Sargon from Star Trek, and not the Sargon from Mesopotamia. So, yeah, hope that helps. I have a couple videos on my channel that mock Sargon specifically. So if you want to go check out those and find out. There are also lots of others because he was one of the most popular skeptic right YouTubers in the YouTube sphere in the post-Gamergate era. He's a big target. I just use him for the algorithm. Not really. I don't use the algorithm very well. That's why I only put out 3 videos in 2 months. Yeah, I hope that answers your question, though. He's not a very smart person, and I despise him because he invokes the name of a figure who's not really part of my pantheon, but kind of tangentially related to my religion. So I kind of have it in for him. That's all. It's sacrilegious, that kind of thing. Anyway, as to what I was saying, because Black people are not dying at the accelerated rate, that means that there is something else at work in the data, because in other states, Black people die at a much higher rate than white people, as well as being infected more than white people, which could be interpreted as, again, the sickle cell thing. They might be more susceptible to it due to something in their genome that we don't understand yet. However, because of the fact here that we are looking at in this paragraph, because Maine has managed to keep the death rate as near identical to the death rate with white people in Maine as well, there's something different happening. It's not genetic, whatever it is, because we have a test case that proves it isn't. They're still getting infected at higher numbers. Now, that could be for any number of reasons that the article will get into later. And we'll discuss other options that the article maybe didn't even talk about. But this is very important. This is how a skeptic should look at this, right? You have data here that contradicts the narrative that you instinctively are trying to debunk with, right? That's the point of debunking as a skeptic. You want to say, well, can I prove this wrong? Can I ask questions that might at least throw this into question? And we're finding the data in the article that tells us that those conclusions are wrong. The reason that I don't automatically assume that my first impulse is the right one is because I actually read the article, Carl. Okay. This is Nirav Shah. He is the head of the Maine CDC. Number of individuals who have been infected by COVID-19 who happen to be racial and ethnic minorities is categorically unacceptably high and unacceptable to every single person who is working on the response, Shah said Friday. We are making strides, but we are attempting to do better in partnership with members of those communities, but I will be the first to acknowledge that we have more to do there. On Friday, Shah announced an arrangement with hotels in 5 cities, Portland, Lewiston, Augusta, Waterville, and Bangor, to provide rooms to COVID-19 infected individuals who cannot safely isolate at home. I like this program. As an aside, it's a very good way of addressing the economic impact that hotels having to be closed and yet not wanting to house COVID patients in isolation at the hospital. It kind of solves 2 birds with 1 stone here, right? While the rooms will be available to any infected people who need them, the effort appears aimed largely at reducing transmission risk in immigrant communities, who again tend to cluster together more and overcrowd apartments. That's just the unfortunate necessity sometimes. As someone who lived in a 1-bedroom apartment with 5 people, I can tell you I understand the need for it at times. Hermeet Kohli, an associate professor at the University of Southern Maine School of Social Work, who serves as board president of the Maine Immigrants' Rights Coalition, said the pandemic has brought to the forefront disparities in healthcare and housing. The state needs more interpreters, trustworthy contact tracers in impacted communities, and more support for the Black, Indigenous, and people of color communities who fill many essential jobs, Kohli said. Additionally, there are increased worries about education impacts on children and families. So, this is telling you various possible solutions to the reasons. The reasons we will reason in our head because, again, this article isn't necessarily constructed in a very anti-online skeptic manner, but it's kind of addressing all the points that they might bring up, right? So, why might the transmission in minority communities be higher than in the white communities? Well, here's an answer. We need more interpreters in the state. Okay, that's a good answer. There might be a language barrier. People can't necessarily read all of the signs that are warning you to wash your hands, all that stuff. Maybe there's a language barrier problem. Trustworthy contact tracers in impacted communities. So people who will actually give up the information and people who can be trusted to take the information. Right? If you are in a minority community and you see some, prim, proper, white-skinned government worker, maybe you don't trust them as much as someone else for whatever reason. That happens. People, avoid cops for the same reason, because of the uniform, because of the look. So maybe you need more trustworthy contact tracers. That is, maybe you need more contact tracers who are working from within these communities. That could solve some of this disparity. The disproportionate systemic discrimination needs to be addressed ASAP in our neighborhoods, communities, and our political leaders need to step up and direct resources and monies to provide the short-term services of the affected individuals, families, and communities, Coley wrote in an email. Our governor's office also needs to create a long-term plan to fight systemic racism. That is the root cause of these disparities. Now, obviously, the Black, Indigenous, people of color in Coley's basically commission, the main Immigrants' Rights Coalition, are attributing specifically the systemic racism as the root cause, which, again, we've been trying to disprove, but we so far have not had the data that proves it. I'm going to check on chat here. Like your Andromeda videos, hope we get more. Oh, thank you. Thank you, Ultra Trekkie. It is the one thing I have wanted to do for like 10 years, and I've been trying to do it. I don't think I'm going to get to my goal of getting Coda out before Ouroboros' 20th anniversary, but I'm still going to try. Let's see. I did have an interesting fight with someone in the Andromeda comments who didn't really understand the Confederate States bumper sticker and took it as an offense to his poor white pride. But that's another issue. Nationally, Black residents have been hit disproportionately hard by coronavirus pandemic in terms of infection rates and economic toll caused by layoffs and widespread business closures. Again, this is more of the same that we were looking at in the data from above. This also includes the economic factors that might be contributing to increased risk, because obviously if you are unemployed, you are spending more time at home, right? More time cooped up with someone who might be infected. That could be a problem too. Black residents account for 24% of deaths nationwide, or nearly 25,000 people as of last week, despite comprising 13% of the country's population, which is what we talked about before. Project, which is a joint venture, Anti-Racist Research and Policy Center at American University, compiles COVID-19 case and death reports filed regularly by state health agencies across the country for analysis. The disparity gap in Maine was at least 25.5 percentage points when comparing the state's Black population cases where race ethnicity was known, which is 26.9%. Based on figures for June 17, the last date for which nationwide data is available, the gap shrinks slightly to 22.2% among all cases, including those where race ethnicity of data of the patients was unknown. COVID Tracking Project's Racial Data Tracker presents data on its website using only cases where the race is known, because the percentage of unknown cases varies significantly by state. Under either scenario, however, Maine had a larger disparity than all other states, again, which is reinforcing the theory that this is sociologically driven, not biologically driven, as someone like Carl would want us to believe, right? We've all seen his, trying to disprove crime and discrimination statistics and his gender gap statistics, right? He tries to disprove that this is sociological. He wants to prove it's biological. Well, here is the proof that it's sociological, right? Why is Maine's infection rate so much higher than everyone else in terms of its disparity gap? But why is the death rate so much lower than the rest of the country in terms of its disparity gap? If it was biological, it would be near identical, or at least not statistically significant as a variance. Unlike many other states, Maine is not seeing disproportionately high death rates among Black residents. Maine CDC data lists only one Black resident among the 102 deaths reported as of Friday, compared to 89 deaths among white individuals. The race or ethnicity was unknown for 10 individuals. So, one death of 102, that is close to the 1.4% that the Black population would be. This is, again, a situation where a few extra deaths might have skewed that number. Say if there were 3 deaths out of the 102, that would be a near double representation. But because the number is so small and the sample size is so small, that might be something to be concerned with. So we'll take that under consideration. This is a small sample size, only 102 deaths. Great job, Maine, by the way, for a state of like 1.5 million people, I believe. So good job, really good job on that. But because that sample size is so low, we would keep an eye on that if we're going to track this problem in future. But it is, as of right now, still consistent, very close to the 1.4% population distribution. It is clear, however... Wait, I lost my place. Oh no. Wait, is this it? No, I lost my place. I have this thing where my mouse kind of glitches out in Opera. So, yeah. 2% and... Oh, there it is, 102 deaths. Maine CDC does not release racial data on COVID-19 cases at the county or zip code level, making detailed analysis of where cases are occurring more difficult. Shah said the agency is looking at providing more detailed geographic information in the future, but in a way that avoids inadvertently identifying infected individuals in areas with small minority populations. This is a concern in Maine. As I said before, Maine has 2 minority centers, Portland and Lewiston. All of their minority communities are basically clustered around those areas. If you take it out of those areas and into the surrounding counties, other cities like Waterville, like Bangor, like Presque Isle, you would probably see a people of colored community that is so small that if you released that, one person of African heritage has caught COVID in Presque Isle, people might actually be able to pinpoint that individual because they didn't show up for work that day, right? So it is a concern that the state tried to address. It is, of course, making data collection on this phenomena much more difficult, but I can understand why they did that. Let's see. Bye, der alt Trekkie. See you later. Let's see. It is clear, however, that the majority of COVID cases are happening in Cumberland and Androscoggin counties, just what we said before, near Portland, Lewiston, and Auburn, which are these 2 counties. Advocates say the clusters are emblematic of the systemic socioeconomic and racial problems. One thing that we are trying to say over and over again is that the disparities we are seeing are representative of the disparities we see always. The kinds of jobs people have access to, the wages, the higher risks people face. Again, there's another sociological risk factor. There are jobs that are higher risk factors, such as service industry and medical industry, and those jobs are higher represented by communities of color. Why is that? That is an important question to ask. That is something that these groups in this article in general is trying to get at, that we need to study that and understand why better. Also need to take steps to reducing those disparities because they do exist and they're obviously not biological. Obviously, your job choice is, or the job you end up at, I should say, not necessarily choice. A lot of people work the job they're stuck at. Why do you get stuck at those jobs if you are one of these communities? A coalition of community organizations, including Catholic Charities, has been working with Maine CDC since March to educate immigrant families, often in their native languages, about ways to reduce infection. These efforts include pamphlets and informational videos in half a dozen languages, including Somali, Arabic, French, and Lingala. Immigrant community leaders say such tailored outreach appears to be helping overcome some of the language and cultural barriers that could be contributing to disparity in Maine. Every time we get information from the CDC or other organizers, we share with them in their language, and that's why there is less risk than before, said Mohammed Bare, executive director of the Maine Access Immigrant Network, which helps provide a bridge to health and social services for new Mainers. More recently, coalition partners are working on increasing access to testing in minority communities and assisting affected communities with such things as obtaining food while in isolation, arranging for childcare, and providing alternative spaces for infected individuals to isolate. Dr. Muhammad Hassan, a community health worker in the Maine Access Immigrant Network, said housing is obviously a key factor in the disparity. Recent immigrants and their families tend to live in more crowded conditions, make it all but impossible for an infected person to isolate from others. And in cities like Lewiston, where many families live in older tenement-style apartment buildings that have multiple stories, but only a single entrance and exit, it raises the risk of contamination. Additionally, immigrants often hold so-called frontline jobs during the pandemic. They have no chance to work from home, so they are compelled to go to work because of economic necessity, said Hassan, who was a physician in his native Somalia. So again, those are other sociological influences that we talked about earlier. We still are we're still going through this, trying to disprove this conceit as the worst COVID-19 racial disparity. We are trying to disprove the conceit that it is sociologically driven, but so far there is no data that would suggest that is not true. According to the Maine CDC, just over 300 of the 743 healthcare workers who tested positive for COVID-19 in Maine, more than 40% of this higher risk group were identified as Black or African American. This is because immigrants fill many of the direct care, personal assistance, and custodial jobs at nursing homes, group homes, and other healthcare facilities. So even among a high-risk group, they are abnormally high risk. So even among this group, this is 743 healthcare workers who have tested positive in Maine. 300 of them have been identified as Black or African American. That's almost half. So we're even higher. We're even higher than this. We're almost double this number. So there's something going on, and it's got to be addressed, whatever it is. Additionally, immigrants comprise a major part of the workforce at many local manufacturing or processing facilities, including the Tyson Foods plant in Portland that had an outbreak of 51 COVID-19 cases last month. Shaw, Maine CDC director, pointed out that some of these workers are among the asylum seekers from Central African nations who arrived in Maine by the busload last summer after crossing the U.S.-Mexico border. Mainers responded by helping house, feed, and care for the new arrivals, even organizing a July 4th picnic for about 150 asylum seekers near Portland Head in Cape Elizabeth. Even more of them are playing a critical role in our economy during this time, working in places like grocery stores and other parts of the essential food chain. Those are the same individuals who we came together a year ago to help, who are in turn helping us in the front lines themselves. So, as an aside, return on investment for immigrant workers. Gotta enjoy that. Maine CDC is working with outside organizations to set up mobile testing labs near immigrant communities to help break down transportation, logistical, and psychological barriers to accessing testing. This is a big deal as well. Transportation issues, obviously, if you take public transport, getting to a testing center is dangerous. which might disincline people to seek testing and therefore treatment. And they might not go until it's too bad that they can't ignore it. In my city right now, buses are not accepting fare, and they're only delivering essential rides, that is to grocery stores and hospitals. That's basically it. If you go somewhere else, they're probably not going to let you back on the bus. That's basically how it works in my city right now. If you are sick and you are using a bus like that to get to a testing site, you might accidentally be infecting who knows how many people who are also on that bus. So that is a problem. Other things, logistical and psychological barriers. If I was Carl, I know what Carl would say. Carl would say, well, psychological barriers, they should just get over themselves. But what it more means is psychological barriers in terms of those psychological barriers that you might feel bad for needlessly exposing people. If there's a testing site right down the street that you could walk to easily, that gets rid of that barrier. Other psychological barriers could be more cultural than psychological. I don't know if I know if that's what they're going for here, but I'll just mention it in fact. There are a lot of cultures where you try to do the least amount of imposition on your society that you can. And if you still have that ingrained in you, there might be a psychological barrier in that regard, which is something we have to adjust for. Because if we don't, that person becomes dangerous, right? They become a carrier. They might infect others because they don't want to ask for too much. That's a psychological barrier that we have to address. Gonna check chat for a little bit. It's weird how skeptics will try to establish the cause as natural. Like, if it's nature, then what? We still have to intervene and address harm, right? Well, yeah, obviously. There are lots of things that are natural that are in conflict with most of human society, like slavery. Slavery is natural. There are animals that enslave other animals. There are animals that rape other animals. Those are all in conflict with society. This is no different, even if it was natural, which it's clearly not, right? We already looked at the data that addressed if it was natural, they would be dying at similar rates and then catching at similar rates. But they aren't, so there's definitely a sociological element here. Jackie Farwell, spokeswoman for the Maine Department of Health and Human Services, said the agency, in addition to arranging isolation space in hotels, is contracting with 10 community action programs around the state to provide food, transportation, housing assistance, and other basic necessities to households under isolation. Additionally, DHHS is working with the Catholic Charities of Maine to arrange for translation, interpretation, and cultural brokering for those in isolation. Again, addressing all those issues that we've already discussed. Just trying to increase access to resources so that we can contain the spread of COVID-19, which is important to do. DeAngelis, the director of Refugee Services at Catholic Charities, said decision makers must trust leaders in immigrant communities who are experts of their own experience. That could mean creating new models and systems for engaging with immigrant communities rather than trying to impose existing systems on them. So, for example, let's go with the worst thing we can think of, right? Let's say a very strict sort of Sharia law community, right? We set up our social services for families. We gear that towards mothers, right? There is sort of this cultural expectation that when we are discussing families, we will be discussing families with mothers as the guaranteed adult in the house, which is a problem, but it's kind of a fact of life that that's kind of how we set up all of our social nets, right? Or at least most of our social nets that deal with family dynamics. So let's say, for the sake of argument, we are dealing with someone who is from a very patriarchal society, who maybe the head of the household is always the man, and maybe it's always the husband or the grandfather, whoever, who is in charge, so to speak, of dealing with outsiders. Perhaps you would want to engineer an outreach model that anticipates that chain of communication so that you can transmit it to them and guarantee that it will be transmitted in turn, that you won't necessarily offend someone who with different cultural sensibilities. After all, many of these people are brand new immigrants. They might not understand, euphemisms or other things like that. You would want to communicate in a way that is sensitive to those barriers, because if you do, if they are too sensitive, if they are too taboo, that person might not transmit the information in turn. They might hold back. They might keep it to themselves. They might not mention it. So you want to communicate it in a way that you know will in turn be communicated to the people who need to hear it, aka those people at home who aren't making the trip and not exposing themselves to more public space. Got it? That's just the worst and most dramatic example I can think of off the top of my head. That is what they're discussing here, that is new models and systems for engaging with immigrant communities rather than imposing them. So that's just the most extreme off the top of my head, right? So that's something that we might want to do. And of course, there are others that might not be quite as obvious because they are from cultures that we are not as familiar with. So reaching out to the leaders of those immigrant communities and allowing them to organize the distribution of information in a way that ensures and imparts how important it is to get the information out there, that's an assistance that could be contributing to this disparity. But DeAngelis said another major part of addressing the disparity is just saying out loud that we see how systemic racism has disproportionate impacts on immigrant and minority communities. Again, this is the director of refugee services at Catholic Charities. We are concerned that we have the worst disparity in the nation on COVID, so even acknowledging that would go a long way, which is true. Now, again, let's anticipate what Carl or Greg would say. They would say, oh yeah, you just want us to feel white guilt about it. No, you want to tell people, hey, our community is leading the country in COVID-19 outbreaks among African Americans. That's a problem. So if you are African American, you are at a much, much, much greater risk of infection. So therefore, it is important that you take a much, much, much more cautious approach. Maybe you take it more seriously. Perhaps people aren't taking it seriously. I'm not implying that for everybody, not in a dismissive way, but it might get through some barrier, right? Some barrier who thinks that, oh, this is just the United States government, this is just whatever. If you tell people that, hey, here's the data, and the data isn't lying, the data can't lie. Here's the data that says that if you are Black, you are 24 times more likely to catch COVID than a white person, then that might catch their attention, right? In a way that is preventative and helpful to everyone in the long run. That is what I think this person, DeAngelis, is here saying. I think it's a woman. Is it? I don't remember. It doesn't say. So yeah, it's not white guilt. That's not what they're talking about here, right? They're not talking about white guilt. They're talking about alerting people to the disparity so that people can consciously compensate for it. Because if you don't know about something, you can't compensate for it. That's important too. So, that basically covers this whole article here. Again, this is from the Portland Press Herald from this morning, 4 a.m. For the Sunday edition. So it was very important for them to put it in the Sunday edition. Black people in America are getting shafted by COVID. And Maine is probably the best test case to show that there is something sociological behind that impact, right? States like Alabama and Minnesota, who might be more impacted, also have higher death rates. But as we established, in Maine, the death rate is pretty identical to the death rate of white people. So there is something sociological at hand. We also tried sample sizes. That didn't work. We also tried disproving it through perhaps a cultural thing. That didn't really work. We also tried to disprove this through employment and education. That data didn't seem to work because, again, like we said, Black people tend to be on more frontline jobs, service industry jobs, but also the educated, the nurses and medical and doctors, they had a 40% representation among infected, which is much higher than even the population density, unless they were just that much more. But the article did not, I don't think. Yeah, they said it comprised some of the risk, but doesn't explain all of the risk in terms of the healthcare workers. So that's important. Even if this 300 of the healthcare workers was subtracted from the service workers, that's still, where's the number? 713. That's still 400 people. That's still more than 13%. That's more than 13 times the population distribution. So even if you cut out all of the Black people from the nursing profession and the doctors and all that other stuff, I don't know if they're all nurses, but most of the medical workers who get infected appear to be nurses. Even if you subtract only the Black medical workers and not the white medical workers, Black people are still grossly overrepresented. So that doesn't explain it either. So we've tried to explain this in many natural ways that are beyond our responsibility, but we failed in each one. Maybe there's another one that I'm missing, but I think we covered them all. Yeah, so we went through like a skeptic, and we tried to disprove that this is society's responsibility, and we came up with zilch. Because we kept thinking beyond our initial conclusion, because we aren't 16 anymore. So that is a problem. This is an issue that hopefully the country will keep in mind and address once the COVID thing is down and gone. Hopefully they'll address it before the outbreak is over. I don't think they will, just because everything is coming at them so fast still. Hopefully they'll make progress. I don't think they'll completely resolve it, but it's something to keep in mind in the aftermath. And yeah, I think that covers everything. I wanted to walk you through this, thinking through it like a skeptic. Like I said, in all my videos, or most of my videos, I consider myself closer to the right than the left. So I can walk you through the thought process that someone might say, is this society's responsibility? Is this society's problem? And I can assure you that yes, it is. It's society's responsibility and problem. So there's that. Stop squeaking. So yeah, that's everything. I think that's all I wanted to do today. Thank you so much for going through this so thoroughly. I don't think Greg Carlgon are after acquiring truth and knowledge. They have already made up their minds. Yeah, that's basically their problem, right? They would always want you. It's the old adage, right? People don't want to hear your opinion or your thought process. They want to hear their opinion coming out of your mouth. And it worked for Carl, and it's worked for Greg, and it's worked for Shu, and it's worked for Stefan, and it's worked for Dave Rubin, and it's worked for everybody who tries to go through this whole let's disprove racism. So yeah, hopefully this is a tool that will help people. Maybe send it to people who you think could benefit from it. I don't know. But this is a process to keep in mind. This is how I thought it was important to stress that it isn't the question that's wrong, right? The question is a fine question. Like, is this the society's responsibility? That's an important question to ask before you dive at it with policy and taxes and all that stuff. But the question isn't the end of the conversation. You have to actually answer your own question as best you can. Or if you can't do it, let the experts answer it for you. So yeah, here's the thought process that you should be using if you think you're a skeptic and you want to keep acting like a skeptic, but you don't want to associate with Nazis. So yeah, that is all from me. Thank you guys for coming. Thank you to Alt-Trekkie. Thank you, That's Terrorists, Bro. I will see there's other people in chat, but thanks. I don't know what's coming next. Damn it, I forget. Because I just did some nonsense video. I'll probably do something about, I don't know, what was the next thing I wanted to do? I mean, there's an electoral college video, but I'm not really concerned with getting that out until, before the election. And there was another one that I wanted to do. Something about, popular rule versus popular consent. That's an interesting topic that we don't get enough coverage of. But yeah, have a good one, everyone. I will see you, I don't know,